Lost memories. Shocking statistics about dementia you need to know. Dementia is a debilitating condition that affects millions of people worldwide. It is a progressive disease that can cause memory loss, confusion, and other cognitive impairments. As we age, the risk of developing dementia increases, making it an important issue that needs to be addressed. It's easy to assume that dementia is a rare disorder, but the reality is alarming. In this blog post, we'll be discussing some of the shocking statistics about dementia that you need to know. From the staggering number of people affected by the disease to its economic and social impact, we'll take a closer look at the facts and figures surrounding this condition. It's important to raise awareness about dementia so that we can better understand it, support those affected by it, and work towards finding a cure. 1. What is dementia and how it affects our memory? Dementia is a general term used to describe a group of symptoms associated with a decline in memory or other thinking skills which can become severe enough to cause a person's daily life to be affected. It is a progressive disease that affects different parts of the brain, leading to a gradual loss of brain function. One of the most common symptoms of dementia is memory loss. People with dementia may find it difficult to remember things like dates, events, names, and places. They may also struggle with communication, problem solving, and decision making. As dementia progresses, it can become increasingly difficult for the person to carry out simple tasks like getting dressed, cooking, and even walking. Dementia can have a devastating impact on individuals and their families. Not only does it affect memory and cognitive function, but it also impacts emotional and behavioral aspects of the individual's life. It can cause anxiety, depression, and even aggression. According to shocking statistics from the World Health Organization, around 50 million people worldwide have dementia, with nearly 10 million new cases diagnosed every year. In fact, dementia has become one of the leading causes of disability and dependency among older people worldwide. It's important to understand what dementia is and how it affects our memory so that we can be more aware of the signs and symptoms and seek appropriate treatment and support for ourselves or our loved ones. 2. Shocking statistics about dementia you need to know. Dementia is a progressive and chronic brain disease that affects millions of people worldwide. In fact, the statistics are quite alarming. According to the World Health Organization, there are approximately 50 million people worldwide who have dementia, and this number is expected to triple by 2050. This means that one person is diagnosed with dementia every 3 seconds globally. Additionally, dementia is the leading cause of disability and dependency among older people. This not only affects the quality of life of the person with dementia but also their families and caregivers. Furthermore, dementia is not just an issue for the elderly. While it is true that the likelihood of developing dementia increases with age, there is a growing trend of younger people being diagnosed with the disease. In fact, it is estimated that there are over 9 million people under the age of 65 living with dementia worldwide. This is known as early onset or young onset dementia, and it can have significant impacts on the person's ability to work and care for themselves and their families. These statistics highlight the urgent need for more research, awareness, and support for those affected by dementia. We need to work towards creating dementia-friendly communities, improving access to care and treatments, and investing in research to find better ways to diagnose, treat, and prevent this disease. 3. The global impact of dementia. Dementia is a rapidly growing problem, and its global impact is quite alarming. According to the World Health Organization, approximately 50 million people worldwide have dementia, with nearly 10 million new cases being diagnosed each year. By 2050, the number of people living with dementia is predicted to triple, reaching 152 million. The cost of dementia also has a significant impact on the global economy. In 2015, the total cost of dementia was estimated to be around $800 billion, and this figure is expected to rise to $1 trillion by 2018. These costs include not only medical expenses but also the cost of caring for people with dementia and the loss of productivity for caregivers and family members. Dementia not only affects individuals and their families but also has a significant impact on society as a whole. It is a major cause of disability and dependency among older people, and the burden of care often falls on women, who make up the majority of caregivers. Governments and health organizations need to work together to address this growing problem and find ways to support those affected by dementia while also investing in research to find a cure. 4. Risk factors for developing dementia. Dementia is a debilitating condition that affects millions of people worldwide. While the exact causes of dementia are still unknown, there are several risk factors that have been identified. Age is one of the biggest risk factors for developing dementia, with the likelihood of developing the condition increasing as we get older. In fact, it is estimated that 1 in 6 people over the age of 80 will develop dementia. Genetics also play a significant role in the development of dementia. People with a family history of dementia are more likely to develop the condition themselves. Lifestyle factors such as smoking, drinking alcohol excessively, and a lack of physical exercise can also increase the risk of developing dementia. Other risk factors for dementia include high blood pressure, high cholesterol, diabetes, and obesity. These conditions can all have a negative impact on the brain and increase the risk of developing dementia later in life. It's important to note that having one or more of these risk factors does not necessarily mean that a person will develop dementia. However, taking steps to reduce your risk can help to protect your brain health and decrease the likelihood of developing dementia in the future. This includes staying physically active, eating a healthy diet, not smoking, and managing any underlying health conditions. 5. Age is a factor, but it's not the only one. While age is a risk factor for dementia, it's not the only one. In fact, studies have shown that lifestyle choices, genetics, and even head injuries can all play a role in the development of dementia. Leading a healthy lifestyle can significantly reduce your risk of developing dementia. This includes regular exercise, a balanced diet, not smoking, and limiting alcohol intake. Exercise has been found to improve blood flow to the brain and promote the growth of new brain cells, which can help stave off dementia. It's also important to stay socially active and mentally stimulated. Studies have shown that those who engage in mentally stimulating activities, such as reading, puzzles, and learning new skills, have a lower risk of developing dementia. Genetics also play a role in the development of dementia. While there is no single gene that causes dementia, some genes have been found to increase the risk of developing the disease. If you have a family history of dementia, it's important to speak with your doctor about genetic testing and what you can do to reduce your risk. Lastly, head injuries have been linked to an increased risk of dementia. This is why it's important to take steps to prevent falls and wear protective gear when engaging in activities that could result in head injuries, such as sports. By taking these steps, you can reduce your risk of developing dementia and protect your brain health. 6. The importance of early detection and diagnosis. The importance of early detection and diagnosis in dementia cannot be overstated. It is crucial to identify the signs and symptoms of dementia as early as possible to help individuals and their families plan for the future and receive the right support and care. Early detection and diagnosis can also help individuals with dementia to access treatment and support services that can improve their quality of life and slow down the progression of the disease. Unfortunately, many people with dementia do not receive an early diagnosis, often because of a lack of awareness or understanding of the disease. In fact, studies have shown that only around 50% of people with dementia receive a diagnosis, and for some types of dementia, such as Lewy body dementia, the figure is even lower. This is why it is important for healthcare professionals to be trained in recognizing the signs and symptoms of dementia and for individuals and their families to be aware of the risk factors and early warning signs. If you or a loved one are experiencing memory loss, changes in mood or behavior, or difficulty with everyday tasks, it is important to speak to a healthcare professional as soon as possible to rule out any underlying health conditions and to receive a diagnosis and appropriate care. Early detection and diagnosis can make all the difference in improving outcomes for individuals with dementia and their families. 7. Can dementia be prevented or slowed down? Dementia is a complex condition and there is still much to learn about it. However, studies have shown that there are steps that can be taken to reduce the risk of developing dementia, or at least slow down its progression. One of the key factors in reducing the risk of dementia is maintaining a healthy lifestyle. This includes exercising regularly, eating a balanced diet, reducing alcohol consumption, and not smoking. These lifestyle changes can help to reduce the risk of developing conditions such as high blood pressure, high cholesterol, and type 2 diabetes, all of which have been linked to an increased risk of dementia. It's also important to stay mentally and socially active. This can involve learning new skills, taking up a new hobby, or socializing with friends and family. Keeping the brain active has been shown to help reduce the risk of dementia, and can also help to slow down its progression in those who have already been diagnosed. There are also some medications that may help to slow down the progression of dementia in some people. These medications are not a cure, but they can help to improve symptoms and maintain cognitive function for longer. Ultimately, there is no guaranteed way to prevent or slow down dementia. However, by making healthy lifestyle choices and staying mentally and socially active, you can help to reduce your risk of developing the condition and improve your overall quality of life. 8. The role of lifestyle changes in reducing risk. Lifestyle changes are crucial in reducing the risk of developing dementia. According to research, up to 40% of dementia cases can be prevented or delayed by making simple lifestyle changes. Maintaining a healthy weight, staying physically active, and eating a healthy diet are some of the lifestyle changes that can help reduce the risk of developing dementia. Studies have shown that regular exercise not only improves physical health but also cognitive function. Exercise increases blood flow to the brain, which helps to promote the growth of new brain cells. It also helps to reduce stress and anxiety, which can be a contributing factor to the development of dementia. Eating a healthy diet that is rich in fruits, vegetables, whole grains, and lean protein is also important in reducing the risk of dementia. Consuming foods that are high in saturated and trans fats, such as fried and processed foods, can increase the risk of developing dementia. In addition, getting enough sleep and managing stress are also important lifestyle changes that can reduce the risk of dementia. Chronic stress can lead to inflammation in the brain, which can contribute to the development of dementia. While lifestyle changes cannot guarantee the prevention of dementia, they can certainly help to reduce the risk. By making simple changes to your lifestyle, you can improve your overall health and reduce your risk of developing this devastating disease. 9. Promising research and treatments for dementia. Although there is currently no cure for dementia, there is promising research and treatments that are being developed and tested. In fact, there are several clinical trials underway looking at new drugs and therapies that could help slow down the progression of the disease or even prevent it altogether. One of the most promising developments is the potential use of stem cells in the treatment of dementia. Stem cells have the unique ability to transform into any type of cell in the body, including brain cells. This means that they could potentially be used to replace damaged or lost brain cells in people with dementia, helping to improve their cognitive function and quality of life. Another area of research that is showing promise is the use of immunotherapy to treat dementia. Immunotherapy is a type of treatment that uses the body's immune system to fight diseases, and it is currently being explored as a potential treatment for Alzheimer's disease. While these treatments are still in the early stages of development and testing, they offer hope for the millions of people around the world who are affected by dementia. In the meantime, there are things that you can do to help lower your risk of developing dementia, such as maintaining a healthy diet, exercising regularly, staying socially engaged, and keeping your brain active with activities like reading, writing, and playing games. By taking care of your brain health, you can help preserve your memories and protect yourself against this devastating condition. 10. What you can do to support those affected by dementia. If you or someone you know has been affected by dementia, there are several things you can do to offer support and make a difference in their lives. First and foremost, it's important to be patient and understanding. Dementia can be a frustrating and confusing disease, not just for the person affected but also for their loved ones and caregivers. Listening and providing encouragement can go a long way in helping them cope with the challenges they face on a daily basis. Another way to support those affected by dementia is to offer your time and assistance. This can range from running errands or cooking meals to helping with household chores or providing transportation to appointments. Every little bit helps, and your acts of kindness can make a significant difference in the lives of those affected by this disease. You can also get involved in fundraising or advocacy efforts for dementia research and support services. There are numerous organizations dedicated to raising awareness and finding a cure for this devastating disease. By contributing your time, money, or resources to these efforts, you can help to make a real difference in the lives of those affected by dementia. Finally, it's important to take care of yourself when supporting someone affected by dementia. Caregiving can be emotionally and physically demanding, so it's vital to prioritize your own well-being and seek support from others when needed. Remember, you cannot pour from an empty cup, so taking care of yourself is essential for being able to provide effective support to others. We hope our article about the shocking statistics of dementia was informative and eye-opening. Dementia is a growing concern in our aging population, and it's important to understand the impact it has on individuals, families, and society. By being aware of the signs and symptoms of dementia, we can help those affected by it and work towards improving the quality of life for those living with it. We hope that this article has provided you with valuable information and inspires you to learn more about this issue. Thank you for reading and raising awareness of this important topic.